president this morning.
We announced some 300 delegates behind Vice President Biden, and the path toward victory is virtually impossible. So while we are winning the ideological battle, and while we are winning the support of so many young people and working people throughout the country, I have concluded that this battle for the Democratic nomination will not be successful. And so today, I am announcing the suspension of my campaign.
Senator Sanders' announcement leaves former Vice President Joe Biden as the presumptive Democratic nominee to challenge President Donald Trump in November. We won't find out until at least Monday the results of yesterday's primary in Wisconsin. Absentee ballots are still coming in. Voters were forced to take extra precautions if they wanted to cast their ballot in person yesterday. Poll workers in Hudson wore masks as they made sure voters stayed a safe distance from each other, and everyone had to wash their hands before casting a ballot.
News from WCCO.
We're breaking into programming with an update from Minnesota Governor Tim Walz on the COVID-19 situation and extending Minnesota's stay-at-home order. Let's listen in.
Good afternoon, Minnesota. Today, I'm joining you for the first time from the State Emergency Operations Center. I want to give a big thank you to Director Kelly and the people who are working here. This is a busy place. This is where a lot of the points of the spear come together and things are directed on COVID-19, but on other state emergencies. As we mentioned yesterday, we've activated the Minnesota National Guard, who is on site, I believe, as we speak, in Marshall County up in Oslo for the flooding, and is coordinated out of this building in St. Paul. So I want to thank you. To the reporters and the media that are here, thank you for the work that you've done remotely as we've had to do this from my self-quarantine. And I also want to mention to the people of Minnesota, because of social distancing and the nature of this room that we're in, the media is working in a pool rotation where they are asking even for others questions. So the collaboration and cooperation that's happening to get information out, I'm deeply grateful for. Once again, we are sad to report we have 5 more COVID-19 related deaths, bringing our total to 39. Once again, I believe 4 of those were in long-term care facilities, and it's an area that we are, of course, focusing on. I am glad to announce that we were able to get our approval from the federal government for our state emergency declaration. Want to thank the federal government and FEMA for the quick response on this. We're moving into the next phase already, as we said, but that'll free up a lot of dollars. I've spent the morning on the phone with the nation's governors, trying to take a look at what the CARES Act's going to do and some of the concerns that we have and some of the things that are positive, and then start thinking to the next level of what we need to do. With that being in mind, it was 2 weeks ago that we issued Executive Order 2020, the stay-at-home order for Minnesota. At that point in time, we were pretty clear of how what we were trying to do. So what I'd like to do is I would like to bring us up to where we're at on this. The order was set to expire on Friday. I want to talk about what we're going to do next in extension and what's driving some of these decisions. And more importantly, how are we looking at triaging for the short term, and then how are we making sure that bridge as we start to think about coming out of this and maintaining for the long term until we get a vaccine on COVID-19. So what I ask you to do, Minnesota, and you've done in a spectacular, very Minnesota manner, is to buy us time by following these rules, by social distancing, by making sure that we're staying home. We're doing distant learnings across the state. And again, I want to applaud the folks who are making that happen and supporting each other, our critical care workers with daycare, all of the stories you hear about folks getting together, cooking meals for them, making sure they're able to continue that. That's what we asked you to do so that we could buy the time necessary to plus up our hospitals, to increase testing, and to see what this thing is going to look like on the other side of it. So I'm going to ask you, we're going to continue to buy time. I'm going to extend today the stay-at-home order until May 4th from the April 10th. We will then align the public accommodation order. That's the issue on bars and restaurants and amusement activities from May 1st to May 4th. This will give us the time necessary to build that prevention and the treatment capacity. I'm going to talk about how we came to this decision, what are some of the implications of it, and where we're going to start thinking differently about this as we come out the other end. On this one, and this is one, if Jan, if you want to, Commissioner Malcolm, if you want to chime in, Why are we extending the orders? What are we looking at? First of all, the CDC came out with their guidance to the end of April, 1st of May, which is basically being interpreted by 42 of the 50 states as stay-at-home orders. It was articulated to us by Dr. Fauci that way, and I think many see it as that. Of course, actions by peer states, and especially those who are early on in the curve, seeing things that were working for them that were making a difference. Looking at epidemiological data on learning more about this, the thing about COVID-19, just in the time since that March 25th announcement on the stay-at-home order, it's hard to imagine that it was 2 weeks ago and only 12 days into the stay-at-home order, how much more we've learned and what's come on board. Just this morning, FDA approving the serological tests on antibodies with basically the finger stick. On with the governors, the federal government is telling us they're going to be producing millions of these by the first part of May and doubling every 2 weeks. Minnesota is going to take a look at that to make sure we have the capacity to do it. Looking at our modeling, which we'll show a little bit, the folks over at the University of Minnesota Public Health, we created one of the first ones in the nation. It's the only one that's populated with Minnesota-specific data. At the time we released our first one, I believe we had 1 case of community spread. Of course, now we have hundreds. At that time, I think we had 1 death in Minnesota. And of course, now, unfortunately, we have 39. The experts we're listening to, that being the hospital associations. And I know that every time I start to speak about changing the stay-at-home orders, our hospitals and our healthcare professionals get really nervous about what that means. And again, that's what they're asking for. So federal government recently extended their nationwide distancing. CDC continues strong guidance for us on social distancing and limited travel, and vast majority of states have continued to do this. Now, I want to take you through some of the data and some of the things that we're putting together. And for those of you at home, if you're seeing what's on the screen, just explaining a little bit about this. What this slide is showing is, and it's normed pretty well with a select group of states, this was the days, and it starts at day 0 on the bottom on the horizontal axis of when you got your first 100 confirmed cases of testing. And Minnesota was testing about right in the middle. So trying to norm this out, this is about as close as we could get. So we were about in the middle of the pack, and this is on, you see on the left side, I'm sorry, I'm going to step away for just a moment, the cumulative cases per 100,000 of what we were getting early on. And then it takes off and shows the curve. And Minnesota has remained relatively flat. And you heard Commissioner Malcolm talk about this. We were seeing early on a doubling about every 2 to 2.5 days. We've been able to get that out to about every 8 days. And what we're seeing now, and what we didn't see and no one had the data necessarily on, was what the social distancing measures were doing for this. But I want to note something. So here we are since that happened. This is modeled to 15 days out of what happened to those first 100 cases. And we went now from about 2 to 100,000 to about 17 per 100,000. And that puts us at the best in the nation. But here's what I want to caution you about. If you look towards the bottom, and I will walk over and show some of you where that's going with Louisiana, on where they started lower and where things shot through the roof. The same thing with Michigan. Michigan being lower than us when they got their first 100 cases, when they had a lower percentage of per 100,000 than we did. In 10 days, 9 days, we were the same with Michigan, that they had caught up with us and they were at 2. So they had gone 4 times faster in just the 8 days. In the next 10 days from that, they have shot through the roof. And that's where you get the pressure on the hospitals. So I want to show you this point in time. Looking up here and looking at some of the states and looking at New York, Michigan, and Louisiana. Take New York, which is the longest one, I guess, maybe it's the easiest one to show that. New York also the same way. If you follow it down, they were the same as us 10 days before this. It took 10 days for us to remain flat and New York to go to crisis situation. So the reason I want to point this out and bring this slide up is we cannot rest easy. This thing can explode overnight if you don't take the proper precautions. And I'm not saying New York didn't take the proper precautions. The problem is that many days back, no one knew how quickly this was going to go. No one had the social distancing in place long enough. So the move to go to social distancing, the move to go early has kept us relatively flat. So here's what we're doing on it. Every day, we're learning more about this disease. The variables that we're able to populate that model with are changing daily. We updated our model and have reviewed the results of additional models across the country. By continuing the stay-at-home order, we buy more time. That's the one thing I would mention about modeling. Modeling was never meant to be an absolute and provide a number. It was meant to show trend and direction. And every one of the models that out there shows trend and direction that if you social distance, you buy more time. If you build up your healthcare capacity, this is the absolute given. If you need a ventilator and don't get one, there's a very slim chance you're going to survive it. If you do need a ventilator and you get one, your chance of survival increases 10 times. So the issue is making sure that happens. Extending early into May pushes our projected peak into July. And those data that we're comfortable with, I'll show you with a confidence interval of where we're at to show why we're thinking that. Staying home has worked by helping slow the spread. So this one, public health experts in Minnesota, including our own Minnesota Department of Health, recommended to me in our office that we extend the stay-at-home order. Minnesota's hospital and healthcare workforce, which are working round the clock, are also asking us to extend this. And I may note when I get to the modeling, our hospitals, especially because of the robustness of it, Mayo Clinic and others, they have their own internal modeling that is not as optimistic as ours. It's a little more, that the peak comes a little sooner and it rises a little more. So we're trying to bump these things off one another of what we're able to see. So here's what the time is for, and here's what I'm asking you as we look towards May 4th. Continuing to partner with hospitals, working with the private sector to buy ventilators, PPE, and supplies. Commissioner Roberts Davis is here, is leading up a team that's making that happen. You'll get to see the results of that. Also, I hope you're seeing we're updating that site we rolled out last week to give you an idea of where we're at. We're trying to provide equitable distant learning. We're planning to protect the most isolated, most at-risk Minnesotans. This is more of a challenge than you might think. There's civil liberties issues to come here. The idea of identifying people and how do we single them out. Most people are doing this on their own, and I'm hearing it from people. I have leukemia. I need to stay home from my job. Those are the exact type of things we're asking people to do, and it's those people we need to protect. We're building on our social distance strategies for starting to reopen society. What we're learning about what works with social distancing and what we're learning that we think we can do economically without jeopardizing the gains we've made, without ending up in a New York, Louisiana, or Michigan situation where you go from being pretty good and handling things and it seems okay to all of a sudden being out of control that fast. It's a bit like this. If we send 4 fire departments to a small wildfire and put it out, we can be accused, I guess, of being a little bit of overkill on it. But the thing is, if it gets beyond where the 4 can handle it and gets beyond where 8 can handle it, the thing starts to double out of control. And that's exactly what we're looking for. And the experts will keep working on new treatments. This bottom part is good. That news today about the FDA emergency approval of the serology test is I think, a really good thing for us. So, I don't know, this one, Commissioner Malcolm, do you want to talk a little bit about this, about where we're at on testing? So.
Happy to, Governor. Thank you. Good afternoon. So as the governor mentioned, we have updated the model and we know how interested you are in that. And I think we're planning a briefing on Friday to get more into what's changed about the model, what some of the new data shows. So we can take a few questions later, but just know that we're going to go thoroughly through the model updates for you. But as the governor has said, we need critically to continue to expand our testing strategies, not only the PCR tests that we do in the laboratory that let us know whether someone is currently infected with COVID, which is so important to our epidemiologic work, our investigations, working with people who've been exposed and their contacts to try to isolate and quarantine. That continues to be critical. But the serologic testing that the governor referenced is going to be a way of helping us know who has already been exposed and who is safe to continue to provide services and care and return to work in the economy. We, as the governor mentioned, we actually, for our size as a state, have been doing not so badly in terms of testing on a per population basis, but not nearly as much as we want to do. Our priority has been around people who are already in the hospital, healthcare workers, people in long-term care settings. But we just recently have expanded the priority criteria to include other at-risk groups, certainly in long-term care, but also in childcare settings and homeless shelters. So we very much want to continue to expand those that are able to be tested with the diagnostic testing. There are still really challenging supply chain issues. The reagents that are required, the chemicals to do the tests, as well as on the collection end of the specimens. Healthcare providers concerned about personal protective equipment and the swabs that are required to collect the samples have become now kind of the limiting factor there. But we are working very closely together. We've got a large group of folks who run laboratories across the state and the healthcare systems trying to help us problem solve every day about how can we collectively increase testing capacity in Minnesota. We also are supplementing the laboratory testing with all kinds of other ways to look at the data to give us a better handle on what we think the true burden of the disease is in Minnesota. The chart that the governor showed you was one of about 15 or 16 different metrics that we're looking at continually to look at the spread of the illness in Minnesota and how we can measure that. So a more robust surveillance system to look at influenza-like illnesses around the state, see how those patterns are changing, is going to help us estimate not just the number of laboratory confirmed tests, which the governor and Chris Erzman and I have all said, we know that represents the tip of the iceberg. We're starting to get a handle on how much bigger that iceberg underneath the surface might be. And this time really does, as the governor said, not only help us increase the healthcare capacity to treat COVID-19 and to continue to treat all the other important health issues that Minnesotans have, but it's also giving us time to build out this longer term, sustainable, more robust testing strategy that's going to help us identify people and help clear them and get them back to work sooner.
And I might note on the testing to Minnesotans, and I was on this morning for an extended period of time walking through this with our legislative leaders. I am not interested, nor do I have the time to understand why we don't have more testing. That is not my point in this. We simply do not, and there is no percentage and no value in complaining about it at this point. That's why we've continued to work for ways around this. The good news is, just since the 2 weeks that we issued the original stay-at-home order, so many more things are coming online. Now, it's still a challenge, but this bottom talking point on this slide is the one that I want you to look at because it falls into our strategy pretty heavily. I talk about the Minnesota moonshot on testing, where I think if we're not able to get them where we're not, we're going to step up the capacity here so to make sure we can test millions in Minnesota. Because it's really great when you give a number like we have 1 million tests, there's 330 million Americans. So even if we get up to 1 million by May on the serology test, that's not what that one needs to be used widely to make sure the number of people. This is a finger prick, almost instantaneous test that we can walk up to this room and we can tell how many people of us in this room have had it. And many of us we know now, and Chris Erzman could tell me on this, up to 25% are walking around asymptomatic that they didn't get anything on this, but they have it. That's the point what we're trying to do right now. We're asking if we can see how all of these things fit together. We're going to extend the stay to get the surge going. How do our efforts to buy supplies meet the surge? And the following slides are going to show you what your sacrifice is doing. First of all, let me explain what you're seeing here. That pink rectangle you see in the middle, using the modeling that we have with a 95% confidence interval, this is the spread that falls in. Now, if we give you a data point at the dead center of that and told you that we're going to hit our peak on June 2nd and need 4,000 beds, that is 1 point of the spread. We can say with 95% confidence that we are going to need a minimum of 3,000 beds starting in the middle of May. And that could be 3,000 beds as far out as July, depending on what we do social distancing wise, and it could go higher. Here's what really matters. That's our current ICU bed capacity that we could fill today. That would be on this day. If we did that 10-day spike like New York did, and we started to fill that up, that gap in between the current bed and the bottom, even assuming best case scenario, bottom is what we would need. But we've not been setting for the last 12 days. What we've been doing is standing up, and in 24 hours, we can double that capacity in hospitals, what they already have ready to go. So if we start to see hotspots, which again, we're getting testing now that can predict hotspots into the future about a week ahead of time. And then with 72 hours, we can move it right under the 3,000. That's what's in place now. That's the work that's been going on. Why we've asked you to stay home. There's also Joe Kelly's team, the Corps of Engineers and others have been working on up to, I believe, Joe, around 3,000 beds now in alternate care sites. Those will not be treating COVID-19 patients. Those would be taking people who are recovering from appendicitis and been able to be in that facility so that we would not fill these beds with anyone else. This is good news. This is progress that's been made. We've made a lot of headway of getting to where we needed to go. From 2 weeks ago, those things were not there. Now, here's another complicating factor, but it's one we're working on. That's the current hospital ventilator capacity. We have gone out over the last 2 weeks and scoured every corner of Minnesota. We have had ambulatory surgical centers that were closed for elective surgery provide their ventilators, their anesthesiology machines that were converted over. So we're setting at about right here with ventilator capacity. And this is what our procurement team, both inside state government and outside, has been able to order. This is what's on order. So the problem is, in that parenthesis is back order. And right now, most ventilator manufacturers are required by law to sell to the federal government. So this conundrum that we're in is when we're told that the governors need to go out and procure this, if we're working with a company who is obligated to sell first to the federal government, we are put on a back order situation. And that's where we start to do everything we can to turn over every stone to try and find these. The good news is, and I would say this, that first to the left, and the April, May, and June timeframe till we get above the beds and just about hit our peak, that we think a lot of those are going to come from Medtronic, who has already committed and already delivered some to us. So that procurement feels more secure to us. The ones going out are a little bit nervous. Now, the argument being made is that when New York will be done by this time, that the strategic national stockpile will be replenished and those will come to us. That's a possibility, but I think it behooves us not to count on that because states are struggling with that. And I might also say where you've seen some states that were able to give ventilators to New York, what's different than that is we have none in strategic reserve. These are all in operating situations. Oregon was Washington State, which is fabulous, helping out New York, but they were given ventilators from the strategic national supply that they did not use, so they sent those on. So I want Minnesotans to know we are more than willing to help every other state. We just don't have the capacity in reserve at this point in time, and it's reckless for us not to figure out how to get to that line. Now, here's the tough one. What you're seeing on the screen is a projected PPE availability. You keep hearing about the shortage of masks, the shortage of gowns, the shortage of face shields, the personal protective equipment that we need both for the healthcare providers and which, if we had enough of this, would be in the hands of childcare workers, would be in the hands of our delivery drivers, some of the things that wouldn't normally have to have it. The problem with it is the supply chain is strained, both here and internationally. I might tell you this, we have private sector partners who have helped with Commissioner Roberts Davis, and we had a significant number of PPE ready to move out of China before the Chinese army surrounded the facility and said they're not going anywhere. Those are the things that are happening now. When the state of Minnesota and a private sector partner ordered these things, they were being palletized and ready to move out until the Chinese army stopped it from happening. So the cone you see is, in a worst case scenario, we drop off and have a massive shortage. If we get this going with the Defense Production Act, if we get it going with some of the supplies as areas start to cool down, like Italy and in Europe, by the time we hit our peak, a lot of these places may be down and the supply will come back. That being the case, we think there is a decent possibility that by the time we reach peak, we will have this. We don't today, as if you see. All right. This is where we would be today. After the 2 weeks, if we stopped and froze in time, this is what would happen. Now, obviously, if we took off the stay-at-home order and reduced down from what is basically an 80% face-to-face reduction and even went back to the 50% where we were at, you would obviously see this change. And if we took everything off and went back to normal, the peak would come rushing back at us and it would probably go up. And that's what the modeling shows. But the next slide shows you what our next 2 weeks will get us. It will get us, one, a bit of a push out. That brings us with the back-ordered ventilators pretty much to where we need to be. And with the social distancing that we're doing, and with Minnesota, at this point, we have enough data to show this. We are overachieving a little bit on this and exceeding where we need on this mitigation process. We push it down with testing and the change behaviors. Now, I say the testing because it's getting better, but it's going to be dependent on how quickly we ramp this up. If we're able to do that, we can, in a pretty, like I said, a 95% confidence level, the bottom part of this falls into us having the beds, us having the ventilators, and having the PPE necessary to treat people in a scenario if it gets to this. Now, many things change. If we're seeing when the data goes in, one of the things we're seeing is from the first model to the second model, the transmissibility of it increased, meaning we went from an R naught of 2.4, meaning one person infected 2.4. We're seeing it's actually one person infecting 4. But what also changed is the severity of the hospitalizations and the length of stay. Those things together, when put into the complexity of the model, change where this is at. So if we don't, we go up a little more and we move back. That's assuming we do the same, but we're not going to. We're going to push it, and we'll get the capacity to be able to push it down. Now, challenges remain. I want to be very clear. I think there are reasons, Minnesotan, I fall into that optimist category on many things, and I think most Minnesotans do. But I also think there needs to be a realist in this. There are challenges. The supply issue is not going away. On with governors today, and I just want to be clear. You heard that we received 15 of the kits. We have not yet, as far as I know, received the Abbott kits. Several states have got them, but I was listening to Governor Kate Brown from Oregon today. They got the kits, but the supplies in it are enough to only do 100 tests. And if you want to reorder the supplies to make the Abbott rapid test work, you're forbidden from ordering those by the federal government because they're taking those reagents. So we're going to have 15 kits that would be really helpful, but we're not going to be able to replenish the reagents to make them work because the federal government is taking those reagents at this point. It goes back to that strategy that I want Minnesota to create our own testing regimen. I want us to build up that moonshot in Minnesota and not count on that supply chain. Our intention is to save every single life we can. That is how we've started this, and that has been our frame. The order impacts, again, Minnesotans' ability to earn a living. You'll hear more a little later from Commissioner Grove for just a few minutes about unemployment insurance. He's got some good news is the $600 add-on from the federal government in the CARES Act has been processed. And I think we're one of the first 2 or 3 states that have got payments out the door on that. So that means people will receive their Minnesota benefits that tend to be very relatively generous compared to other states, and then $600 on top of that. So we have a breakdown of this, and the commissioner can talk to you about that. In some cases, people are going to replace their entire income that they by being off. And I know, and we talk about the economic implications of this. I certainly recognize we don't want to disincentivize people or incentivize people from not working. But we also, in this case, in this rare circumstance, we certainly do want to keep people out of dangerous situations, and we also want to make sure they can pay their bills. So that's where this goes, 13-week extensions, and you'll hear a little more from the commissioner on that. He'll talk SBA loans, he'll talk Minnesota small business loans. And before I come to a final slide and we do just a quick brief and then take a lot of questions from all of you, I want to mention in this that as we redid the executive order, one of the things you're going to find in the executive order is me asking my commissioners who are working with the health department and with businesses to develop short-term plans to help more businesses reopen. We're going to try and ask them in the very short term to create protocols based on social distancing and best practices that doesn't change the progress what we've made, doesn't put people at risk to exposure, but allows us to reopen some of the industries that were not considered essential the first time. I just want to be very clear about this. I don't believe any other state has tried to do this at this point. I will not sacrifice the health of Minnesotans and the gains that we've made. These hard-earned gains and fights and sacrifices, as you saw on the one slide, can be lost virtually overnight if we don't do this right. The thing that has got us in a better position is a lot of people, yes, because there was an executive order, but you're following it, you're doing it, you're trying to social distance. And so none of that is going to change, but we think because of Minnesota's behavior and because of some of the variables unique to our state, that there is the potential for us, and I'm asking our team to find that as quickly as possible. This will not be turning on a light switch. This will be a complex way of restarting the economy where you're going to have to go in a proper order. Because the one thing that I am most worried about is signaling to anyone, to the healthcare industry or to Minnesotans, that we're out of the woods and we can relax what we're doing. That's not what this says. What this says is, with data that we've gathered over basically the month that we've been doing this and the 2 weeks of stay at home, we've learned a lot. And we think the potential is there to be much more exact, much more scalpel-like in going in and trying to make things work, and giving people the opportunity to prove, like we have already, that Minnesotans can get this right. So this is written into the executive order. There are some other changes that are in there, allowing businesses to go back and manage their inventory. Some of the things is where agricultural rules around landscapers, letting people at this point in time mow their golf courses with social distancing, some of those types of things. But this bottom part is about, the message today is stay home, continue this. We bought the time we needed. We're getting close to doing and accomplishing what we needed. Capacity of hospitals, capacity of ventilators, capacity of PPE, and keeping our first responders safe and their families taken care of. But again, I would caution you, if you looked at the slide, it could all go sideways very quickly if we don't continue. So these sacrifices are working. I said it the other night, the only vaccine we have is social distancing right now of what you're doing. We're proving that it works. And again, at this point in time, we have flattened the curve more than any other state. We are able to keep that for a longer period of time. We are getting close because of geography and the way this virus has burned through the world and the country. We bought some extra time that it is still entirely possible. And I think with the work I'm asking you to do is for us to avoid the overflowing of the hospitals, thus putting our neighbors at risk. And the quicker we do that with the work that's being done on testing and some of the therapeutics, the quicker that we're ready once we try and resume normal life, thinking about the next time this comes, more than likely in the fall. How are we going to be able to test who's immune to it? How are we going to keep those most vulnerable isolated? How are we going to make sure we continue to restock our state strategic reserves? So with that, I think what I'm going to do is Commissioner Malcolm, if you want to add just a minute or two of the specifics for today, we'll go to Director Kelly. This will take us just a couple minutes, and then we'll go to questions.
Thank you, Governor. Well, just to reinforce the governor's important message, we have made some progress. It's important that we sustain it. But we do know that the peak is still going to come. We know there's a lot of disease in our state that has yet to show up in our case counts, and unfortunately in the rates of death in Minnesota. But we are starting. We have started from a good position, and we need to keep up the good work. Globally, as of this morning, we were fast approaching 1.5 million cases across the world and 83,000 deaths. The United States was reporting just almost exactly 400,000 confirmed cases this morning, over 140,000 in the state of New York, 77,000 in New York City alone. The US is now reporting almost 13,000 deaths, over 4,000 in New York City alone. Here in Minnesota, today we have 1,154 confirmed cases, so up 85 from yesterday. We confirmed 5 more deaths, as the governor has said, for a new total of 39. 4 of those were elderly persons who had been residents of long-term care. The 5th was a resident in the urban area in their 50s with underlying health conditions not associated with long-term care. I do want to just take a quick moment to say again how much we appreciate the work of the folks in our infectious disease division. who are doing contact and case investigations and working literally around the clock. So I think I've mentioned before, this group has already reached out to over 1,150 people within 24 hours of getting their lab results back to interview them. These are tough calls to do, since many of these people are in some cases frustrated at how long it took to get their results back from the national commercial labs. They're worried about their results, and they can be certainly distressed if we're calling them about an ill family member. I want to acknowledge that these calls are very difficult for the person receiving the call, but also for the person making the call. It takes its toll, and these folks are doing this 7 days a week, 16 hours a day. So I want to thank our health department employees for doing this vital work to help contain the spread of the disease. I want to talk just a moment about COVID-19 in rural Minnesota. Yesterday, we talked about COVID-19 and its impacts on diverse populations experiencing health disparities, and those are real, and we need to keep our eye on doing everything we can specifically with the communities that we know are going to face a higher burden of this illness because of their existing health disparities with respect to many, many kinds of chronic diseases. But today I want to mention another group of Minnesotans who are at higher risk, and that is Minnesotans living in rural areas of the state. We've seen some metrics suggesting that people in some of the rural areas of the state may be following the social distancing guidance with a little less rigor, perhaps lulled into a sense of security, a false sense of security, I would say, by the fact that most of the cases so far are in the Twin Cities and other urban areas. However, our past data on Minnesota's population health statistics show that rural Minnesotans are, on average, older and also have more underlying health conditions than the state population as a whole, which means they too are at higher risk for severe COVID-19 related illness. That fact, combined with the smaller number of hospital beds and other health resources in rural Minnesota, means we really need people in all corners of the state, rural and urban, to be taking this risk seriously, and we need all Minnesotans in all counties to please follow the health and social distancing and stay-at-home guidance. Thank you. Director Kelly.
Thank you, Commissioner, and good afternoon, everybody. As a member of the team that's working to help make sure that our state is as ready as we can be when our COVID-19 peak hits, I thank all Minnesotans for continuing to do the right things under the stay-at-home order and the other social distancing guidelines that are out there, because that gives us more time. And as the governor said, that's more time to get ready. And Governor Walz talked about how important, how critical that is for our hospitals. But it's also very important to the work that we're doing next door in the State Emergency Operations Center. We're going to make the best use of that time that Minnesotans are buying for us to finish up the planning that we've done on these alternate care sites and prepare some of those for use, just in case our hospitals do need to free up some space to take care of the most critically ill patients. We'll use that time to accumulate as much PPE, supplies, and medical equipment as we can get our hands on. To support our healthcare workers, but also our long-term caregivers and our first responders. You're giving us time to put a medical sheltering plan together. And that's going to help people that we either know are infected or we think might be with the coronavirus, a safe place to go in case they're homeless or their living arrangements don't allow them to have the right social distance from the other members of their household. So thanks for giving Minnesota that extra time to get ready. As the governor mentioned, we're also grateful to the federal government for very quickly approving his request for a major disaster declaration, which will provide more FEMA assistance to Minnesota as we proceed. And as a former soldier, I'm profoundly grateful to the men and women of the Minnesota National Guard who, in the midst of all of this and whatever else they had going on in their lives, put the needs of other people ahead of their own and reported for duty in Oslo today to help that town fight another Red River flood. So thank you for the time. To tell you, I'm glad and proud to be a Minnesotan today, because I really think we're rising to meet the challenges that the governor has articulated. So with that, I'm going to be followed by Commissioner Steve Grove with the Department of Employment and Economic Development. Commissioner.
Well, thank you, Director Kelly. Good afternoon, everybody. As the governor said before, we have some good news to share in the realm of unemployment insurance, which of course is the primary backstop we're using to help Minnesota workers get through this time. We are among the first, if not the first state, to be able to process these additional $600 payments that came in through the Federal CARES Act. That's thanks to our team working throughout last weekend to build that, the financials and the technology into our system so it would be ready. And as soon as the Department of Labor turned on that ability last night, we were able to process almost 200,000 applications for that additional $600 for a total of about $115 million. This is so important for workers who need that money to get by during this time. And as the governor said a moment ago, it's actually, when you take the amount of money that Minnesotans are getting through our typical program, add that $600 on top of it, many Minnesota workers are actually making more on unemployment insurance during this time than they would in their day-to-day work. It's an odd incentive structure to be in place. And of course, there's some challenges that come with it, but at a time when we're asking Minnesotans to stay home, we're grateful for that federal money. And of course, are going to get every penny of it to the Minnesotans who deserve it. If you've applied for that money, you don't have to do anything additional. If you're in the system, we will proactively reach out to you with that additional $600 as fast as we possibly can. And it backdates to March 29th. That's when this began. And so please be patient, but we expect checks to hit into bank accounts as early as later this week. You may not see it inside of your actual platform on uimn.org, but it will end up in your bank account, and we're grateful for that. Numbers continue to rise, of course, for unemployment insurance. We're at 367,194 total new applications since March 16th. That's a rise of additional 12,925 yesterday. For those of you watching the numbers, we are trailing off a little bit. Still lots of applications coming in, but not at the same rate that they did last week. We're about 5,000 applications down compared to last Tuesday, for example. So since last Friday, essentially, that trend line has been beginning to decrease significantly. And with that, we've been able to open up our call lines more often, so people are able to call in. We, again, do recommend that you go to uimn.org to take care of all of your questions and to apply. But if you need to talk to somebody, you can give us a call. We're taking about 6,000 calls a day. Wait time's around 62 minutes, which isn't great, but certainly is better than it could have been given the staffing increases that we've made over time to ensure that we're working hard for Minnesotans. Governor mentioned business assistance. He's directed us to look at ways that we can begin to get non-critical sectors back to work when the time is right. Of course, we'll only do that under the proper social distancing guidelines. And, you know, in the meantime, we want to make sure that all small businesses are aware of the programs that we have lined up to help in the interim. The SBA.gov website has a lot of great programs there. Every business should take a look. And one of the most important ones is a quick $10,000 grant that you can get from the federal government within about 2 days if you apply. We suggest every small business do that. And of course, there's a paycheck protection program, which pays up to $10 million in wages over time to protect the jobs and wages of workers during this difficult period of time for Minnesota businesses. Our small business assistance programs in the state have begun to churn out lots more money. We're up to $2 million of state dollars that have ended up in the market as well. That money comes even faster. We've done about 60 total loans, and those continue to rise every day. And the team can get those out in about 36 hours once they're applied for. So again, we're doing everything we can to get Minnesotans money fast, to help quickly during a difficult time. And, you know, given the extension of the stay-at-home order, we know it's all the more important to help small businesses, help unemployed workers, and that's what the governor has directed us to do, and that our team at DEED is working hard on every day. With that, I'll turn it back to the governor.
Thank you, commissioners and directors. This is the first time I have been in the presence of them for about 16 days. We talk often every day, but to be in visual shot of these folks is really gratifying. I know much work they're doing. Please, let's open it up for questions now. I'm sorry we took a little extra time, but I wanted to go through the decision making of the news today is the extension of the stay-at-home order till May 4th. The bars and restaurants till May 4th, schooling till that point, with some changes to this and an expectation as more capacity to test comes online and more ability to social distance at workplaces that can start up again. We want to see that happen.
Can you please clarify any changes to the existing order? You mentioned that maintenance folks could come out to golf courses. Any other changes for landscaping, golf
Yeah,
courses?
the landscaping was in there, and I don't want to speak out of order on this. We call it essential for their businesses. A lot of folks just need to, owners of these businesses need to get in there, manage their perishables, manage their their inventories, some of those things. So there are some specifics in there like that, but we did not get to the point. I think what the big change to the executive order, well, first and foremost, keep people home, keep it at the 80%, but creating the commissioners and that expectation that that team will start crafting the protocols of how we start adding more exemptions as we go forward. They're not written in right now.
Continue to add more.
Absolutely.
During this.
Yes, and that's the biggest change and the difference on it. But what I want to be very clear about is, as I've told people, if it were safe and we could protect people, we would of course start every business tomorrow. We're not certain that's the case, but we do think that there are many out there, mowing of the golf courses being one of those, that fit social distancing, that makes sense, can get things going. What we want to see is with the health department, with DEED, with labor and industry, and with businesses all together start to look at this. And we looked all over. We look at these stay-at-home orders across the country. They don't all quite look the same. There isn't thinking towards that. Now, I want to be very clear before people say all the work we did, all the flattening, all the putting us in one of the best positions and the buildup, you're going to jeopardize that. No, we're not going to jeopardize it. But we don't believe some business can go back because it poses the potential for spread. We won't do that. But what's different with this order is there's a mechanism in there to make that happen much more, I would say, orderly, strategically, and geared towards an end.
And all landscaping allowed?
I don't want to speak out of order on that. There will be some parameters around it, but it's been pretty much opened up. The ag department will write the rules on that about what can be done, and they're finalizing that now.
So these people, the golf course mowers, the landscapers, et cetera, can they go back to work tomorrow, or is there some lag time?
I don't want to speak out of order. I think when I sign it, the way it goes, and
Yeah, I'll follow up.
will you follow up to make sure on that? I think it's our intention that it goes into effect right away. Yeah.
With these, you said in the presentation that your commissioners are going to start working with businesses in other industries
Correct.
to see if they can put protocols in place to potentially go back to work.
That's right.
How quickly, because there's a lot of small businesses emailing us every single day,
Yeah.
when are we going to be able to go back to work? When do you anticipate that that's all going to play?
That's going to start right now. That goes with the order. They've already been planning during these 2 weeks. As I asked them, is there potential? We hear those same things, the people asking, and I want to get them back to work as quickly as possible. And I know there's a lot of folks saying, oh, for goodness sakes, there's 2 of us that work here. There are exceptions to all the rules, but I think what I want to highlight is our stay-at-home order has been successful in pressing down the virus. Now I want it to be able to press down the virus, buy us more time, and get as many people back to work as we possibly can. We think that could be fairly significant, but again, I will not do anything to risk it, but they're working on this right now. They're building the protocols. It may be an understanding and an agreement with the manufacturer. Maybe they make solar panels and there's no worker within 20 feet of each other in a large warehouse. They don't touch anything.
And you have to answer your first question. They can go back tomorrow morning. It goes into effect tonight, 11:59.
11:59.
You mentioned R0 of 4, which almost seems contradictory to a successful stay-at-home strategy. We shouldn't be seeing that much spread. If you were the commissioner, can someone explain why that is so high and what unique factors in Minnesota may be contributing to that?
I think it's national.
Yes,
It's national.
correct, Governor. The R naught, just as we've learned more about the disease and the transmissibility and the role that asymptomatic people are playing in the disease. So that higher R naught is not just about Minnesota. That's national data. So,
It's higher than what it had been seen internationally. Are we doing something wrong?
well, questions about whether the original calculation was right. It might have been understated for lots of reasons. As we've just got more experience globally, and as we've understood more about the degree of asymptomatic transmission, that's really what's pushed up that number.
And a follow-up question on that, because the governor had mentioned 25% of people walking around with it. Is that again a state?
Chris, is that about right?
A state number, a national, but provide more on that. We just right now, there's 4 of us walking around with it in this room.
Yeah, no.
Yes, so Chris Erzman, Director of Infectious Disease. So just to clarify that a little bit more, the R naught was based on the experience in China and other places, but as the governor and the commissioner have said, there's been more data on asymptomatic transmission with some of the cruise ships. They were doing multiple rounds of testing, found that people were asymptomatic, and then many of them went on to be pre-symptomatic and develop symptoms, but about 17.9% continue to remain asymptomatic. So right around that 20% mark. So that is what's partially contributing to that increased R naught.
It's a great question, and it totally highlights this idea of the serology test. If we could walk through this door today as you were there with a 5-minute touch the finger, get a result, we could find out in here who's had it, and then start to understand that immunity.
Are you going to there's a reference in the presentation to organizing and increasing our testing efforts?
Yes.
Are you going to organize antibody testing? We won't have enough. You're going to prioritize as a state who gets that.
Yes, I believe we are, and I'm telling you that ahead of time. We've spoken fairly extensively. I spoke the other night with Dr. Ferrugia as they were getting the national contract, Dr. Ferrugia being the CEO of the Mayo Clinic. There's others that have the possibility. He put it out not from a Mayo Clinic perspective, but from an epidemiology perspective, that the belief here is that this could be a key factor in restarting things and getting things back up. The White House today is briefing everyone that they're going to do this. We just got told on the governor's call that they're anticipating having 1 million of these. The FDA approved it, I believe, this morning for this test, that they want to have 1 million of them by May and then double it to 2 million by June. We don't think that's fast enough, and we don't think that's enough of them. I'm not complaining about that. What I'm thinking is, if we have that technology right here, and if the state, and I'll talk to legislators, I'll talk to the folks who can do this, if the state stands up our own and we become in partnership with someone, the ability to run these out. And if it proves that that's right, I want to be very careful of, there's still some work to be done on this. It's still very early on. There's no guarantee that this is the panacea, although it looks really good. And the answer to your question is, if it's showing that we can test quickly and rapidly with accuracy of who has antibodies, and if the state can invest in that to test as broadly as possible, we will stand that up. And I think that's our goal at this time.
I've heard from a Republican lawmaker who said that this person's been very supportive to you up until this point and believes your decision today was a mistake, not to create more exemptions, especially for outdoor workers, small businesses under 10. And this lawmaker fears you will begin to lose public support now.
Well, I don't know where this lawmaker got their information. Did they listen to the public health experts? Did they use all the things that we have? And did they hear what I said is, we're not saying that we can't do that, but we're not just going to release them. What evidence and what data is this person saying that we should just give a blanket and you should go do this? The commissioner's right. We know by county who's adhering to these things pretty well, and we're seeing some that aren't doing it as well as others. And so, I would simply say that the data and the 42 states that are following this general direction, where we diverge from them is we think we've got the capacity, because of our testing capacity and because of our social distancing is working the way it is, that we have the capacity to smartly bring people back in without jeopardizing this. So no, I disagree with that. That maybe as a lawmaker who would have agreed with Governor DeSantis to keep the beaches open. I fully disagree with that. So I don't believe that's the case. I think Minnesotans understand what it's going to take to do this. They understand what the data shows, and they see the trend line that's going.
Governor and Commissioner, about the modeling, which you said you would take some questions about today. I'm curious, because you had mentioned the stark number of 74,000 Minnesotans could die if the state did nothing a couple of weeks ago. I'm wondering, with the social distancing that's in place now, what are the projections on the deaths now, and when is that peak?
Yeah, and I would note on this that all of the modeling, keep in mind when the president finally decided that we were going to go all out on this, the numbers they used that day was 2.2 million for the United States. They revised to about 100 to 200,000. And I think the thing, and I want to be clear, is that there was just a lack of data early on. And I have to tell you, there was a large discussion in our office about this, because that number shocked me. And I went through this. I said, well, we're not going to not do anything. We're going to do a lot. We're going to reduce this. But one of the questions come is, imagine if we had that data, didn't put it out there, worst case scenario happens. Imagine the questions you're asking me as governor. You knew this could kill this many people and you didn't move forward on that. We thought and had that discussion and thought to put it forward. I'll have Jan go what we're seeing now, and it's significantly different if we continue to do what we're doing.
So again, I would just mention, as the governor said, the model version 2.0 is more precise. It has newer data. So even under the second run of the model, if you will, version 2, that original hypothetical starting point, if we had done nothing, so sort of the comparison case, the numbers in the new model came down from 74 to 50. But that's within a very wide range. So that would be like somewhere between 34 on the low end and 68 on the high end. The governor spoke of the 95% confidence interval, that the range is that wide. So that was in, again, the hypothetical scenario of if things had just gone unmitigated. So there isn't a precise, and we really still want to really counsel people that we're not predicting a certain number of deaths will happen or won't happen with these scenarios. It's directional. It's all about helping us understand which levers have the biggest impact. And what the model confirms, the Minnesota model and the other models that the governor has talked about, is that the biggest levers really are building up ICU capacity and isolating the most vulnerable. So the model continues to confirm that and continues to suggest that if we continue the population-wide social distancing and then continue to work hard to build up the capacity and keep the most vulnerable people more protected, that we can manage to much lower mortality figures.
So Dr. Fauci has said 100,000 to 200,000 nationwide if social distancing is in place. What's the model show here? If social distancing is in place, how many will die?
The lowest of the ranges is around 6. I think the kind of the middle of the range that various of these scenarios suggest is in the 20 range. But some of the variations are 6 to 9 to higher. As the governor indicated, some models interestingly show a lot lower deaths, but a lot faster peak. And we keep hearing about the Washington model and why is that so much lower in terms of deaths. We're trying to understand that too. We're also, as the governor said, comparing numbers with some of the health systems that are looking at their own data. In fact, we're meeting tomorrow to kind of lay out what's the same and what's different about some of these assumptions.
Can you talk to us about indoor versus outdoor transmission as the weather gets nicer, people are wanting to be outside? I noticed on that chart, peak demand, June, July, that's when Minnesotans are outdoors. Is it safer? Is there less transmission outdoors than indoors?
Well, typically that's been the seasonal pattern we've seen with many other viruses, that as we're less confined indoors, that natural social distancing happens outdoors. The weather itself, to the degree that particles, if you cough or sneeze in dry air, they hang around longer. In warmer, humid air, they fall to the ground faster. All of those are factors. But I think even in outdoor environments, we really want to be very, very careful with not clustering in close groups and not having the family picnics where we're all hugging, as much as that is our instinct, that we still have to be careful in those environments.
So should we all cancel 4th of July and cabin trips now? Is that what that looks like when you see that June, July peak?
Well, we hesitate to say, let's just cancel summer, but I think we do have to, again, learn how things progress and be smart about some social distancing strategies that just keeping in mind the value of trying to maintain more distance than we typically would, and those personal behaviors that hand washing and the hygiene around being very, very careful where you cough and sneeze are just so very important. We're going to have to keep up with those behavior changes for a long time.
Could you address that too? You've lived in Minnesota a long time. You know that culture of going outdoors, gathering, June, July, that peak really times out at that time.
Yeah, it's hard. The weather's hard. I saw it at the dog park, and people are doing pretty well. They're social distance, not a lot of masks, but we do worry about that. We worry, and I think we're encouraging people to get out, stay healthy, but then I know that there's kind of a contradictory message, but don't drive up north and overrun Mille Lacs or wherever it might be. Those folks are asking us, please, the irony of this is that they really liked us going up there every other year and spend money up there and building the economy. But now they know well enough what happens, that 2 or 3 cases in a rural hospital is enough to overwhelm the ventilator situation. And so what I'm encouraging people to do is to think smartly about this. I hear you on these outdoor activities from people saying, hey, what about the boat storage places? At least let them open up for a day to let us go in one at a time, get our boats out of storage. That makes great sense. That's what we should be doing. Smartly, make sure there's protocols. How do we do it? Same thing with the golf. And I know there are people saying, wow, what an elitist thing to worry about or whatever. Well, if it's their activity, there's an economic activity associated with it, and there's also a mental health associated. We're trying to look across the whole spectrum. So it's not going to be a typical summer, but I'm envisioning if we get this right, where we're not driving people over, we're being somewhat courteous to one another. I can picture Minnetonka being overrun with people who would have normally some gone up north, all on one small lake. We're certainly not going to have the party barges, coming together, but we're going to have to think about it, and we're going to have to work together. And I just keep reminding Minnesotans, this hasn't been done before. So we're learning, listening, and being smart about it. And this either or, I'll go back to Mary's question, this either or that all of a sudden today something magical happened. Look at that divergence line of New York, Michigan, and Louisiana if we don't think about how we do that. But I'm being very cognizant about hearing people when they're asking and saying this activity should work. And so please keep working with us on this. I'm listening to DNR on what they can say works. We're allowing people to pay, by Dropbox and not put them in contact, but it still gets crowded out there.
I mean, if the Chinese army is now surrounding a stockpile that we were counting on, does that mean some of our delivery, the things we're expecting that are listed as needed for delivery are no longer coming to us? And should we be more pessimistic than on our PPE? Are we going to go on that downward slide you showed on the upward slide?
Good afternoon. I'm Alice Roberts-Davis, Commissioner for the Department of Administration, and I'm overseeing the critical care supplies work stream. And although that is one instance that happened, we have been seeing supplies coming in from overseas. We feel like we're very well positioned. Most of the things that we ordered have been accessible to us. We've been working very closely with corporate partners who have been able to assist us in getting some of those products across the water. And so we're feeling very good about the situation that we're in. We'll continue to place orders and continue to watch them for insurance that they are going to be delivered.
With the current trend, then do you see a trajectory that is positive that will allow us to have enough PPE for the peak, or do we need to have better happen to get there?
It's a very crowded marketplace now. It's very good, these supplies. We'll continue to place orders and leverage every connection that we can. It'll be iterative ordering because just as things become available, we continue to place orders and expect that our vendor partners
work through that weekend to give us some time. And I keep coming back to this, or at least stepping it up, that change a lot of how we go. Our thinking is to take it in chunks like that, some of these back online, if we're able to match it up with what the
committee that NDH is running out of.
Would comment too, but I think Commissioner Roberts Davis, strategic national stockpile model, where it's all about housing and pre-position them close to long-term care, but with as well as the medical grade equipment that long-term care needs. So I think in terms of the state stockpile
long-term care facilities, as Commissioner Malcolm said, we do have some stock of those coming in.
Some of them are getting sick. They're watching residents get sick.
You remember I went out and spent, this was an in-home worker, but spent a day. Broader question, Mary, about society reprioritizing where it intersected with public health. We've really got to think about that. Keys to the car, if you will. The first briefing you get is emergency, whatever it might be. So you sit down with those people, and when we were all told then to go find it ourselves, the people who prepare ahead